Thank you, everybody, for staying on, and I want to thank the organizers to invite me to give this interesting topic, but very formidable because my opponent is a well-researched in phytotherapeutics, much more than me. I dabbled into this in mid-2000 is because my clinician, at that time I was working on biochemistry of gags and all that, and he started to notice that the patients that he was looking after, they were taking Chinese herbal medicines at that time, and he asked me, because I was a basic biochemist at that time, to look into if there are any changes in parameters in urine. That is how I started doing work in Chinese herbal medicine and then looked into other phytotherapeutics. So luckily, I had a positive experience with all these phytotherapeutics, so that at least I will argue the pros of it. Just to go away from the actual, I want to just define some of the things that we are talking about. So the herbal medicines are basically specific and general, that would have general pharmacokinetic effects. And there are other things, naturopathic, nutrition-based, lime juice or juices, or some kind of diet, modification of diets. Those are naturopathic. And the other one are homeopathic, that are symptomatic management. So I won't be talking about those two. I'll be talking mainly about the herbal medicines. So in general, when we look at the literature of studies being done in vitro or in vivo or even clinical trials, we come across some of these names that you'll see. Herneria hirsuta, Philanthus niruri from Brazil. Herneria hirsuta has been also well studied in Morocco, and I know it was a work of Atmani, and also Said Khan also worked on this quite a lot. And then Philanthus niruri has been quite around for a long time. And of all the phytotherapeutics, this is the most well studied, and it has already gone through 3 clinical trials already in different places. So it is quite well studied and demonstrated. And then there was a campo mixture from East Asia. This had a lot of publications, peak in publications in 80s and 90s, and then it leveled off. And then there are some Ayurvedic drugs. Now, one must realize that some of these drugs are coming from countries and are published in the native languages. So even for my Chinese herbal medicine, I had to ask my postdoc to search those journals in the native languages, which are not published in English. But sometimes you do get abstracts that are in English. So the one that I worked with was this one, Jin Chia Chow and Shi Wei. And I'll just briefly go through what was our positive experience with this one. Some examples and pictures to give you an idea for what these herbs look like, actually, the actual plant and how it is done. So this is one of the herb capsules that we had also studied in vitro. It's made out of bark, fungus, and another plant that is, this one, Zuling, is a plant that they mix and pulverize it into a powder or pill form. There are some pills available over the counter. These are fresh herbs that are bought from herbal medicine herbalist, actually, and they will package it like this, and they tell you to decoct into a small 1-bowl soup. So you start with 500 ml of water and cook it down to about over 3 hours to 1 bowl of soup. So that's one of the ones that I worked with, because this is very popular in China and Hong Kong with very minimal side effects. Then there's the other one, Jin Xiao Chow, Hygiene Sha. And all these, I'm showing you the actual plant, what they look like, and what they would be sold as in the market. In the herbalist store, they'll be sold like this, and they'll give you specific instruction of what to do with this. And the other one is Dong Cuisine. So all these that I showed you, I've worked with them in vitro before I picked Shi Wei as for my clinical trials that I did. So one of the most well-studied that I talked about just now was Philanthus niruri. And this one is, I think, the most well-characterized according to literature up to date, up to 2022. And several clinical trials have shown a positive effect or what I would say moderately positive effect of reduction in recurrence of stones. So one of the ideas, I'm not saying that phytotherapy will replace Western medicine, is to look at it synergistically, because that was how I was brought into this, because a clinician was doing all the Western medical methods of doing it, but he noticed that the patients, when they were coming up for follow-up clinics, they were inadvertently also taking Chinese medicine at the same time. So that's why he asked me to look at it. So I would like to look at it from a point of view that it should complement the Western medicine, and it should work synergistically to have a better patient outcome. If it doesn't, then you should not be taking these things. So that's my point. And whatever the Western herbal medicine that you're using, it must be very well characterized down to the components. And so that is very important. And this is the stage at which some of the herbal medicine do not get through. It is not very well characterized. You don't know what the components are. You just have anecdotal observations that, oh, this may cause more diuresis, or this may have increase in citrate level because innately it might have more citrate in it and alkalizes your urine. So they're more anecdotal rather than telling you exact pharmacochemical that is there in the drugs. So that's the stage where I think herbal medicine is right now. Phytotherapeutics arrested and is going very slow at this pace. I did a search of publications, and on the left side you see publications just related from PubMed to urolithiasis, renal stone disease, but not related to plants or anything, just general. And you can look at the numbers. This goes up to 2,000 year on year, number of publications, clinical or in vitro data. And then if you look on the right side, as soon as I plug in N plants or medicinal plants or herbs, it drops to 100 less. Look at the publications, handful of publications that actually come out, whether it's in vitro or even clinical trials. So that's the reason I think it's the acceptance of publication is not out there. I can tell you from my personal experience also, because once you put a paper out with a clinical trial, you get badgered on, did you try this, did you try that? And once the clinical trial is over, you cannot go back and do this, and did you try that? So you either accept the paper as is, or you don't. So this is I think, what happens here. I want to mention a few studies that I'll see that have very positive correlation, and one of this is Monti and Trincheri studies, and this was a very good study. They did a metadata analysis of basically phytotherapeutics and the outcome measures. So they were looking at, one thing was whether it reduced the stone burden, it reduced calcium oxalate and urea concentration, and in addition, they said whether there was minimal adverse effects. So they looked at these three factors, and they did a metadata analysis, and they pictured it on this graph here, where it shows those with low risk being the green one, and those with high risk biases being the red one. So this was a very good review, showing you there were some positives. And in fact, I would say there were more positives in reducing stone burden from this paper. Then we come to some studies that were also done by Micali, who worked with Philantus neurui. This was the first human clinical trial that was done with this drug. And that was just the time I dug in myself into herbal medicine that time. And then a recent finding, this was also repeated with Giri Babu in 2014, which he showed that it actually increased antioxidant activity also. There was also an Ayurvedic formulation for this to show the decrease in stone parameters and episodes. We also, I had a collaboration with Professor Alan Rogers also on the one that I was working on, and he also took that to work on his side in South Africa, but he found, in fact, no effects, basically. But there were at least no adverse effects. There were no toxicity or anything like that. But like I said, the study had limitations, small population pool, so have to look at comparability. So here there's, I won't go through the whole thing, but this you can see there's a lot of studies going on, in vitro, in vivo. Still the publications is limited by clinical trials, human trials. So these are all either in human urine, but these are not clinical trials, but these are just showing in vitro whether they reduce crystallization, they reduce calcium oxalate secretion, and you can see most of it, if not all, are showing positive results. And of course, in vitro and animal studies, you cannot see adverse effects unless you look at other parameters of toxicity. So there are complex mixtures. There are toxicity. One has to have good manufacturing practice. And I think the problem is we don't have a clear idea of the pharmacokinetics of these herbal medicine phytotherapeutics. And one of the things is, with increase in stone blasting, ESW and PCNL, follow-up of patients to do more metabolic evaluation is quite hard, because I can tell you from my experience, which I'm doing right now, 24-month clinical trial, is we get them every 3 months. I've already had a 20% dropout rate. It's just to keep them coming back every 3 months for blood and urine and scanning it has a high dropout rate to keep them interested. So the implication is that there are ethnic population of wherever they live. They will work with what is available around their surroundings or from their traditional practitioners. The usage may be as high as 40 to 85% in certain ethnic populations. And also some medical practitioners, I'm talking about the Western ones, should be aware that they may be silently taking these medications without telling them. So it has to be revealed. And the non-reporting can be as high as 90%. So going from basic research to clinical practice, we've seen Philanthus neruri going very high. Recently, Dhawan and Albini has also concluded there was a moderate clinical efficacy of P. neruri in reducing stone burden. And I would say this one is one of the most characterized and a positive outcome for phytotherapeutics. And there were other clinical trials from Brady and the Ayurvedic drug herb made from Cretivia. And I don't know if anybody noticed this outside Auditorium 1. This was just outside Auditorium 1, this advertisement of this drug. But basically, it has a diuretic effect. But if you look at the ingredients, it's mainly antioxidants, vitamin A, vitamin E, vitamin C. So they're mainly antioxidants in this. But this one, I'm not endorsing. I don't have any disclosure or anything. But I just saw this outside, and I thought I would put it up here. So anyway, I'm going to wrap this up now. So what we had was we worked with, in our study, we had about basically cohort of study that 50% had accessed traditional Chinese medicine. And in Hong Kong, Western hospitals are always with the traditional Chinese medicine inside, so they will access it. So that's why we had a high rate. So we used this drug, Shi Wei. It has been known to cause diuresis. And it was a randomized double-blinded placebo-controlled study with 50 recruited. And we did see a diuretic effect and increase in magnesium, which is also beneficial for patients to prevent recurrence. It had a better patient outcome, and we did all the other metabolic measurements, but it was only specific gravity was reduced and magnesium was increased when using this drug. And there was no adverse side effects at all. So we do have problems with regulatory and statutory bodies that we have to comply with. So we did do all that. We did the clinical ethics approval. And now in Hong Kong and Singapore, actually, both TCM and Western medicine is now used concurrently for treating renal stones. They will accept it. And even the European Scientific Corporation of Phytotherapy defines specific phytochemicals. So in summary, I would like to say I have had a positive experience working with phytotherapeutics. And in general, most of the herbal drugs are devoid of any side effects. Studies are needed still for prospective long-term outcomes, such as a study by McCallie and also by Dhawan. And also the recent finding of antioxidant activity that Said was proposing that it could be oxidative stress. So what are we looking at? Future prospect is my last slide. That the study be well designed and regulated. that Western plus herbal medicine should be seen to be complementary and synergistic, although we still have poor understanding and limited clinical trials of several of the herbal drugs that have been studied in vitro and in animal studies. And when you go to clinical trials, you're going to have compliance issues, whether they're taking it and the dosage, so it has to be taken in the clinics. And one of the things that we realized while conducting our clinical trials is we did not look at diet, and diet varies quite a lot. High meat diet, low meat diet, so that's another consideration one has to consider also. So thank you very much. I tried to keep within my 15 minutes, and Said, to you then.